As we move toward the muscular system, we need to talk first about articulations, or how bones are joined together. When muscles contract, they pull bones and move them at articulation points or joints. Understanding the movements that are allowed at articulation points can help you understand how muscles function to move the body. And articulation is where two bones interconnect or join together. In other words, we are talking about the joints between two bones. There are two different methods to classify articulations, and these are based on the function of the joint and the structure or anatomy of that joint. The first way joints are classified is based on function. The first type is synarthrosis. With this type of joint, there is no movement between the bones. Next is amphiarthrosis. In this type of joint, there is some movement between the bones. And lastly, there is the diarthrosis. In this type of joint, there is a lot of movement that can occur between the two bones. When we consider the function of these types of joints, there is a correlation between stability and the mobility of the joint. When you look at the different types of joints, what you should notice is that the less mobile types of joints are stable, while those that are very mobile are less stable. If you think critically about this relationship, this makes sense when you think about the functions of these various joints. For example, the sutures between the skull bones have no mobility but are very stable. When we consider that the sutures between the skull bones create a structure that protects the brain, this makes sense. Joints that are not mobile will protect the brain much better than those that are mobile. As we go through the chapter, I want you to think critically about how the structure of a joint is directly related to its function. Ask yourself this: how does the structure of this joint relate to its mobility, and how does that relate to its overall function? To classify joints based on structure, we're going to look at the anatomy of that joint. This focuses on how the joint is built. There are four main structural classifications of joints: a bony fusion, a fibrous joint, a cartilaginous joint, and a synovial joint. Now, let's look at both the structural and functional classifications of the joints found in the human body. First, we start with synarthrosis joints. These joints are immovable. Typically, these joints are made between two bones that are fused together, connected by fibers or collagen. First is the suture, which means sewing together. In this case, there is a very thin layer of dense, regular connective tissue holding these bones together. Sutures are only found between the bones of the skull. Agomphosis, which means a bolting together, is a peg and a socket type joint. The tooth sitting in the maxilla or the mandible represents agomphosis. The periodontal ligaments are small fibrous areas that hold the teeth in place and create a joint. Normally, this is an immobile joint, but if you've ever had braces, you certainly know that you can realign your teeth, but this is a slow process that must take place over time. Normally, your teeth are firmly rooted in the maxilla or mandible, which is a good thing. Otherwise, you might lose a few the next time you eat a nice piece of taffy or caramel or something that's chewy and sticky. A synostosis refers to two bones that are joined by a bony fusion. The prefix syn means together, and ostosis refers to bone. So essentially, the term synostosis means a bone holding two bones together. Examples include the metopic suture of the frontal bone, as mentioned earlier, and the formation of the epiphyseal line that fuses the diaphysis of the long bone with the epiphysis. Next up is synchondrosis, which refers to two bones that are joined by cartilage. The prefix syn means together, and chondrosis refers to cartilage. So synchondrosis means two bones held together by cartilage. An example is the epiphyseal plate, which we see in a growing long bone. This area of hyaline cartilage connects the epiphysis of the long bone with the diaphysis. This type of joint is also found between the first rib and the sternum. Now we will move on to the amphiarthrosis type joints. These are slightly movable joints. In this case, bones are connected by cartilage or collagen fibers. These joints are more movable than the synarthrosis type joints discussed earlier. Syndesmosis refers to two bones held together by fibrous tissue made from collagen fibers. Just as before, the prefix syn means together, and desmosis refers to a ligament. In this case, we have two bones held together by a fibrous ligament. Examples include the connection between the ulna and the radius in the forearm or the tibia and fibula in the leg. The fibrous connective tissue connecting these bones is referred to as an interosseous membrane. This type of joint allows the bones in the arm to rotate around each other as with supination and pronation. There really isn't much movement in the joint between the tibia and fibula, but there is no need to supinate or pronate the leg. Next up is the symphysis, which is a cartilaginous joint. Here, bones are connected by a pad of fibrocartilage. Examples include the intervertebral discs between the bodies of each vertebra and the pad of fibrocartilage between the two pubic bones where they articulate in the pelvis. In between the bones of each vertebrae, there is not a lot of movement. However, when these small movements add up, you are able to flex and extend your vertebral column. There is not much movement between the pubic bones. However, this joint does become a little more flexible during pregnancy to allow for birth of an infant. Last are diarthrosis-type joints. These types of joints are freely movable joints and are typically located at the ends of your long bones. All diarthrosis-type joints are synovial joints. These joints are complex and have many structures associated with them that are important for their function. Characteristics of synovial joints include a joint cavity that surrounds the joint and is filled with synovial fluid. An articular capsule covers the joint and consists of two layers. The first layer is an outer fibrous articular capsule, and the inner layer is a synovial membrane. The outer fibrous articular capsule is a fibrous connective tissue layer. It's very tough and consists of dense regular connective tissue and is continuous with the periosteum of the bone. The inner synovial membrane is the inner layer and produces synovial fluid. Synovial fluid is a thick, rich fluid, kind of like honey or cold pancake syrup. This fluid is rich in proteoglycans. It has many functions, including lubrication, nutrient distribution, and shock absorption. As you move the bones, the joint compresses and then releases, and this movement helps the synovial fluid circulate within the joint cavity and provides that extra cushion and shock absorption. The articular cartilage is hyaline cartilage. This cartilage is very smooth, slick, and contains a lot more water than hyaline cartilage and other places in the body. Within the joint cavity, the hyaline cartilage acts like a sponge that's filled with synovial fluid. In addition to the joint itself, there are also several different accessory structures. These consist of additional cartilages and fat pads. Menisci are pads of fibrocartilage that are found between the bones within the joint capsule. This helps to subdivide the synovial cavity. They also channel the flow of synovial fluid and allow for variations in the shapes of the articulating bones so they can fit together more appropriately. Fat pads are covered by synovial membrane, and they can help protect the articular cartilages. They also act as packing material within the capsule. When you look at this image of the joint, you can see the meniscus of the knee helping the femur and tibia articulate together more easily. There are some fat pads within that joint cavity as well. In addition, there are some accessory ligaments that help to support, strengthen, and reinforce the joint. There are two types of ligaments associated with a synovial joint: extracapsular and intracapsular. The extracapsular ligaments are located outside of the joint cavity, such as the patellar ligament or the collateral ligaments. The intracapsular ligaments are located inside the joint cavity, such as the anterior cruciate ligament or the posterior cruciate ligaments found in the knee. There are several tendons from muscles that help to support and provide some stability to the joint. Bursae are small fluid-filled pockets that contain synovial fluid and are surrounded by a synovial membrane. Bursae provide some extra support for areas of high stress around the joint. If they become inflamed, it causes something known as bursitis. This happens when the joint is overused. The inflammation will heal on its own with some rest. Now we will look at how these different types of synovial joints function by looking at the movements that are possible within the joint. There are different planes or axes that can occur at various synovial joints. There can be angular movements that occur from forward to backward or left to right. There can be rotation. There can be gliding type of movements. Lastly, there can be something called circumduction, which is a type of angular movement. In some cases, there is a combination of these basic types of movements that can occur at joints. Synovial joints are classified by the type of movement they permit. In general terms, a monaxial joint permits movement in only one axis. This could be an angular movement that is forward and backward, or left to right, but not both. A biaxial joint is one that permits movement in two axes. This will be angular movement that is forward and backward and right to left. Joints that are described as triaxial permit a combination of angular movements and rotation. These joints are the most mobile of the synovial joints. Non-axial joints are synovial joints that permit small amounts of movements, typically in a gliding or sliding fashion. There are 6 different types of synovial joints. You are responsible for knowing each of these types of synovial joints. For each type, you need to know which structural category they fall into, their description, and examples as provided in this table. The last part of this chapter deals with movement at synovial joints, and although you may feel silly doing this, the best way to learn it is to practice these movements. You want to start by standing in anatomical position. From this position, if you bring your arm out toward the front of your body, that is flexion. And if you take your arm back to the anatomical position, that is extension. If you kick your foot back, that's flexion, and if you bring your foot back to anatomical position, that is extension. With flexion, you are decreasing the angle between two bones at a joint. And when increasing the angle between the two bones, this is extension. Hyperextension is when you go beyond anatomical position. Abduction is movement away from the midline, while adduction is moving toward the midline. For circumduction, imagine drawing a big circle with your arm. Except for the head, rotation movements are somewhat smaller, rotating your arm at the shoulder or the leg at the hip, for example. Rotation of the limbs can occur laterally or medially. With inversion, you are moving the sole of your foot inward, and with eversion, you are moving it outward. For protraction, you are pushing the mandible out, and with retraction, you're pulling it back in. Supination is rotating the palm forward, while pronation is rotating the palm backward. With elevation, you are bringing the jaw up, or you're bringing the shoulders up. And with depression, you're opening your mouth. Opposition is when you move your thumb to your pinky finger. With dorsiflexion, you're bringing your foot up, and with plantar flexion, we're pushing it back down. You should work on practicing these movements. As we move into learning the muscles in the body, understanding these movements will be very important. This ends this chapter. As always, you are encouraged to use these learning outcomes to prepare a study guide for yourself.